For decades, medical imaging has helped doctors and researchers see inside the human body and diagnose disease. Now, a new generation of scanners is revealing something more, showing how organs and diseases behave and how treatments work across the whole body in a single scan. Through the National Imaging Facility, Australia's researchers have access to a national network of advanced infrastructure and specialist expertise that makes this work possible. Total body PET scanners are an example of this transformative new imaging technology, such as here at Sydney's Royal North Shore Hospital, a partnership with the University of Sydney.
Total Body PET is a state-of-the-art digital PET system that has a long axial field of view, which means you can image the total body simultaneously. There's a lot of potential to do very new and exciting imaging protocols. For researchers, this might involve very rapid scan times. It might involve very low radiation dose, which of course opens up the potential for things like paediatric studies. It can also allow researchers to follow the kinetics of a radiotracer for hours, if not days, after injection. And this is really important for those who want to look at things like developing new radiopharmaceuticals.
For researchers, this technology opens the door to entirely new studies, accelerating discoveries from labs to patients' bedsides. And for those patients, it means shorter scans, clearer images, and safer options for people who previously had limited access to PET imaging.
We're now able to perform a PET-CT study on a pregnant patient where the total radiation dose to mum and fetus is less than 1 millisievert. That's about the same as you or I would receive just from natural background radiation living in Sydney for 4 or 5 months.
Advanced imaging technology creates real-world impacts by enabling researchers across Australia to work on one of the world's biggest health challenges, cancer. Using total body PET scanners at Peter MacCallum Cancer Centre and the Alfred, in association with partners from Melbourne and Monash universities, researchers can develop better ways to track cancer's spread and create precise new nuclear treatments.
We are looking at new radiotracers that have never been used in a human before. And we want to know exactly where is this radiotracer travelling in the body. On a previous PET scanner that only had 30 centimetres, we could focus on a single organ. On this scanner, you can lie in the device and we can just see it moving live throughout all your organs, throughout all your body in a way that's never been possible before.
But these kinds of benefits don't happen through technology alone. NIF connects specialist researchers and clinicians with world-leading advanced imaging equipment, enabling them to develop new ways of using it.
It's much better to establish a network of scientists and research infrastructure capability that's connected and networked together. And this is a network that's now growing not just in Victoria, but right around Australia.
The impact of this new research is measured not just in innovative methods, but in impacts on the lives of patients. Lee was diagnosed with prostate cancer more than a decade ago. Doctors initially gave him only 3 years to live, but he defied those predictions.
Every year that I survive, it means that the technology gets better, and it also means that the treatment gets better. It's just absolutely amazing technology.
As well as this important work in cancer, imaging infrastructure at the Alfred, in association with Monash University, lets researchers ask entirely new questions about relationships between the brain and body.
We know that many conditions, such as healthy ageing, schizophrenia, other psychiatric conditions, neurodegenerative illnesses like dementia, they affect both our minds and our body. However, we haven't been able to measure this sort of interaction between mind and body in real time, and that's really what Total Body PET allows us to do.
Advanced imaging is transforming what is possible in medical research. The experts accessing cutting-edge technology is the first part of the story. The clinical outcomes that these innovations bring provide hope for patients to enjoy life for as long as possible.
I'm a keen cyclist. One of my favourite things to do on a bike is to ride up Mount Hotham. I really would like to get back up to Bright and ride up Mount Hotham and maybe a few gravel tracks also.
Through access to shared infrastructure and specialist expertise across Australia, the National Imaging Facility is enabling the country's researchers to turn discovery into clinical impact and patient outcomes.